This is Michael Smith of MedPage Today. The use of dietary supplements for pain has been growing, although evidence for their benefit is often inconclusive. That has been the case for glucosamine in low back pain and degenerative lumbar osteoarthritis. But in this week's issue of the Journal of the American Medical Association, Norwegian researchers report that a large trial in such patients showed no benefit from the substance. Dr. Elaine Husney of the Cleveland Clinic, who was not part of the study, says it will help doctors guide treatment.
I think there's just been a huge sort of public awareness about using dietary supplements, and glucosamine definitely floated to the top of all of this in terms of osteoarthritis. We do tell our patients that there are studies in hip and knee OA that, or osteoarthritis, that have shown that glucosamine can decrease the pain. But however, on a larger scale, as you saw with this JAM article, as well as an NIH trial called the GAIT trial, G-A-I-T, showed in 1,600 patients with knee and hip OA that it did not show any benefit to pain. However, in that study, a small subset did show some relief. So I think overall we have to be a little more selective about who we do recommend this to. But overall, I think these studies these larger studies are definitely helping the physicians realize that on a large scale that we do not see a difference with the use of glucosamine in terms of pain.
In her own practice, Husney said, she'll be less likely to suggest glucosamine to all her patients.
I think it's still important to note that there might be a subset of these patients that can still benefit from this, but overall I probably now are less likely to recommend it as a whole to all patients.
On the other hand, the substance appears to be safe, she said, and there might be some patients who would benefit, especially those who can't tolerate such things as non-steroidal anti-inflammatory drugs.
So I think as a physician you need to take all of these results into account, not just the sort of one-line final result, but you need to really read these studies and look at it and say, you know, there is a subset to benefit, so perhaps I should be more selective about how I recommend it, and I might be able to find a group that might benefit, or at least try it. So I do tell my patients, you know, try it for 3 months, and if you don't notice any difference, don't waste your money on it anymore.
I'm Michael Smith, MedPage Today.